As women move through their lives, their health care needs change. You may have heard of the term midwife before, but what exactly does a midwife do? Here to tell us more are two certified nurse midwives, Courtney and Carolyn. Good morning to you ladies.
Good morning. Thanks for having us.
Absolutely. So that's a big question. How is it different if you guys are all delivering babies and doing the same type of thing? It starts actually way before the baby even comes, right?
Yeah, that's right. Carolyn and I are both certified nurse midwives at Spectrum Health. We have a team of nurse midwives there. We're registered nurses. We have our bachelor's degrees, and then we have master's or doctorates with training in midwifery.
Okay.
We're board certified and licensed in the state. And our philosophy of care is really that pregnancy and birth are a normal part of women's lives. So we see our role as one of midwifing women through the process, educating them on what's normal, what's not normal, recognizing complications, and consulting with physicians as needed, and then being there through their labor and birth to support them through the process and to help them at the time of their birth with their baby.
And how do you actually work with the team as a whole? If you want to get a little bit more into that, because I think some people picture a midwife and maybe at-home births like back in the day type of thing, but you actually do deliver some of these babies in the hospitals, correct?
That's correct.
Yeah.
Certified nurse midwives have been at Spectrum Health for actually quite some time. Well, you find them in private practices with various OB groups, and also we've been in OB triage for several years providing care with our nurse practitioner colleagues there. But more recently we've been working on transforming the model of care at Spectrum Health, or changing the way we do care, and we're doing that with team-based OB care. What team-based OB care is utilizing OB physicians and certified nurse midwives together in a team in our areas of expertise, so that we're providing really safe, high-quality care to the women that we are caring for during labor and birth, and also postpartum.
Yeah, and if someone's trying to consider whether or not they want to go with a midwife, what things do they need to take into account for when they're making that decision?
Good question. We tend to care for women with uncomplicated pregnancies who are generally healthy, who have low risk for any complications during pregnancy and delivery. You know, most women choose midwives who are planning for a normal physiologic birth. You know, they may choose an epidural or not, a natural birth or unmedicated birth or not, but a lot of women choose midwives for that extra support and education that they get throughout the process. And you know, just our philosophy that things really are normal and part of a woman's life cycle.
And I have a niece that was delivered by a midwife, and of course that's the only childbirth I've ever experienced as far as seeing her taking part of. But I noticed when the midwife was talking to her, she was explaining how she was doing a few things a little differently. She was kind of walking us through the process as a family. So are some of the breathing techniques different? Are some of the ways to get comfortable a little different that you guys do than?
Go ahead.
Yeah. I was just curious because I thought that was very interesting.
Our philosophy of care is to sort of partner with a woman and her family and try to really individualize her care to what she and her family need and want during their labor and birth. So we support all sorts of different ways to get through that process. A lot of women who choose a midwife do want a natural birth, and so we are often providing some support and education about techniques to get through that. There's a lot of different classes and techniques available for that. So we see ourselves as sort of information keepers, and will provide all of the information that you need, and then a woman or family makes the best choice for them about what method they'd like to use. So all kinds of different methods, and there are women who seek midwifery who do want pain medication but want more support through their pregnancy and through their birth, and we're available to provide that as well.
Really neat. Okay.
Yeah.
It's really interesting. You can learn a lot more online, of course, and the certified nurse midwifery, not midwifery. Okay, midwifery. It's available at Spectrum Health Medical Group, and for more information or to make an appointment, check them out online at shmg.org/womenshealth. Thanks so much for stopping by, ladies.
Thank you for having us.
Thank you.
Absolutely.